Hello guys, so now we shall be discussing about the sinuses which are located within the pericardium. Okay, so this is one of the very important topic. We shall discuss about the sinuses of the pericardium. So what are the different kinds of sinuses in the pericardium, guys? In the pericardium we basically have got two different types of sinuses. What are these two different types of sinuses? One is called as a transverse sinus, another one is called as a oblique sinus. Okay, so one is called as the transverse sinus, another one is called as your oblique sinus. Okay, two important sinuses we have got. One is called as your transverse sinus and the other one is called as your oblique sinus. Now we shall look at what are these transverse as well as oblique sinuses. Okay, so if you look at the transverse and the oblique sinus, first of all you have to look at the heart. So let me draw just a rough picture of your heart, guys, just a rough picture. Right, so this is just something, a rough picture of your heart. Right, now all of you know that this green color layer which I am drawing right now is your fibrinous pericardium. This is your what? This is your fibrinous pericardium, the same picture which I have discussed in my previous lectures. Right, so this is your fibrinous pericardium, this is the base of the heart. Now after the fibrinous pericardium, let us say this black one is called as not serous. Okay, I will tell you where is serous pericardium. This black one is called as a parietal pericardium. So when we have the fibrinous pericardium, the green one, the black one is called as a parietal pericardium, and where is the serous pericardium? I will draw now. Okay, but before that you have to know few important things. What are those few important things? In the heart, what are the structures you have got? You have got aorta, you have got pulmonary artery, right? And you have also got superior vena cava and inferior vena cava draining into the right atrium. You have got pulmonary veins. So these are the five important structures that are located within the heart. Okay, so all of you look now. This is your aorta. I am just drawing the cut sections. Okay, cut sections. This is your aorta. Now after this is your aorta, here on the other side, this is your pulmonary artery. Pulmonary artery. All of you know aorta and pulmonary artery, they are both side to side. Okay, now after that, next important thing is here you have got a vena cava. This is called as superior vena cava. Whenever there is superior, just below that there will be inferior. So here you have got inferior vena cava. Okay, now let us draw the pulmonary veins. So let us say here there is one pulmonary vein, this is another pulmonary vein on the right side. These are called as right pulmonary veins, right? And you have got one pulmonary vein on the left side and another pulmonary vein on the left side here. These are called as left pulmonary veins. Okay, now where is serous pericardium? Where is serous pericardium in the sense? Serous pericardium or visceral, that is the one which is covering your organs, right? So there are two types of peritoneum, there are two types of pleura, there are two types of pericardium. What are they? Here you have got the parietal layer of pericardium and visceral layer. Parietal is outside, visceral is surrounding the viscera. Viscera in the sense the organs. So it is surrounding the aorta, it is surrounding the pulmonary artery, it is surrounding the superior inferior vena cava and the pulmonary veins. How it is surrounding, we shall look into that right now. Now let us say, let me first write it down also so that it would be easy for you. This is your aorta. Okay, this is your pulmonary artery. And this is your superior vena cava, this is your inferior vena cava. Okay, and these two structures over here, these are called as pulmonary veins. Okay, so just I'll write it as PV, pulmonary vein, here also pulmonary vein and pulmonary vein. I'll label it later on. Okay, now surrounding this we have got some important structures to discuss. What are these structures? Now all of you look here. First important thing is that surrounding this inferior vena cava, okay, surrounding this inferior vena cava, you see this structure which we are drawing right now. What is this structure? This is your serous layer. In serous layer, which layer again? Parietal or visceral? This is the visceral layer. So this is the visceral layer of pericardium which is surrounding these structures. You see how it is surrounding? This is how it is surrounding. And when it comes to the aorta and this one also, the same thing goes on here. This is the one. Okay. So here if we label the things, this one is your fibrinous pericardium. Okay, so this one over here is your fibrinous pericardium. And let us say this black one over here is called as your parietal layer of pericardium, and this one over here is called as your visceral layer of pericardium, parietal as well as visceral, right? Now exactly, if for you to understand better, let me draw these structures here. So exactly here you have got your superior vena cava. So exactly down here you will have your inferior vena cava, and after that here you have got your aorta. So this is your arch of aorta like this. Okay, after this arch of aorta, here you have got let us say common carotid artery, here you have got your subclavian artery in this way. Okay, and after that here you have got your pulmonary artery. This is your pulmonary artery in this way. Right? So this is the overall structure which you need to know. Now here there are two important signs, and by the way, not to forget, just write these things here. These two are called as the right pulmonary veins. These two over here are called as your left pulmonary veins, right? And not to forget one very important thing I am telling you here, that there are two important sinuses. Our main topic is only about the sinuses. There are two important sinuses. So as I have promised, what are the two important sinuses over here? You can see one sinus that is running like this. Now this sinus is running behind the aorta and the pulmonary artery, right? So this sinus is called as a transverse sinus. And next you have got one sinus in this way over here. This sinus is called as an oblique sinus. So there are two important sinuses over here. So this sinus over here is called as your transverse sinus, and the sinus over here is called as your oblique sinus. Now why do we need these sinuses, guys? Basically, whenever you are doing any kind of heart surgery, right, what you do, you connect a heart-lung machine to the heart. Okay, you connect what? A heart-lung machine to the heart. So what is this heart-lung machine doing? This is the heart-lung machine that is outside the body, which is doing the same functions as a heart and the lung does. So what you are doing is that you are doing a surgery on the heart. Now when you are making an incision, what can happen? There can be blood that will be oozing out, and patient will go to hypotension and shock, and then he'll die. So what I have to do is that I have to temporarily divert the blood supply of the heart to another thing. That is what is called as the heart-lung machine. Okay, so for that what I will do is that, see, aorta and pulmonary artery. So let us say this is aorta, this is pulmonary artery. Okay, now look at my finger. This sinus which is going behind the aorta and pulmonary artery, this is called as transverse sinus. Okay, this is a cut portion, so you are not understanding here, but this is a full one. This is a transverse sinus. Okay, so if I show to you another picture over here, you will understand it perfectly. You see aorta and pulmonary artery, behind that I am able to put my finger. Why? Because there is a sinus there, there is an opening there. That is what is called as your transverse sinus. Okay, what will I do is that I'll put a finger into the transverse sinus, right? Along with my finger I will put one ligature, and then I will tie the aorta and then I will tie the pulmonary artery temporarily. After tying it, what will I do is that I will attach two pipes. One pipe I will attach to aorta, one pipe I will attach to pulmonary artery, right? These are catheters, and these catheters I will go and attach to the machine. Now this catheter which is attached to the aorta will work as an aorta. This catheter which will attach to the pulmonary artery will work as an artificial pulmonary artery. And the blood from the heart is pumped into that machine, and from that machine to the heart. So this is how the movement goes on. Okay, so to stabilize this, listen here very carefully. So if I have to stabilize, this is what I was telling you. So I will put two wires. See, here I am putting a pipe like this. I am making an opening and putting a pipe. So I'll cut this part over here like this, and again I'll put another pipe like this. Now when I'm putting the pipe here, when I'm putting the catheter, not the pipe, it is a catheter here. When I'm putting a catheter here, this catheter should stay there. If it has to stay there, then I have to tie this catheter to something. What will I do is that I will take a small ligature, and ligature in the sense a small rope in your simple language, and then I will tie it down here. You see, I am taking it and then tying it down. It is a very simple procedure, guys. I mean, procedure might be difficult, understanding it is very simple, right? So what I am exactly doing is that this is a pipe, for example. Okay, this is a pipe, and what I am doing is that this is my aorta. So this pipe I have attached to the aorta. Now when I am releasing my hands, what is happening? The pipe is falling down. So what will I do is that I will attach it here, and then I will put a ligature around it. Okay, so that is what I am doing here for the surgeries and all. You basically use this. And next important thing I want to tell you is that I've discussed a lot of things about this pericardium, right? So if there is infection within the pericardium, you call it as pericarditis, right? So if there is infection here, if there is infection, now when I am telling infection, when I am drawing these lines, don't think there is infection to the fibrinous pericardium. No. If there is infection to the serous pericardium, that is what is called as pericarditis. Okay, that is what is called as pericarditis. So whenever a patient is having pericarditis, if you are not treating it, this can lead to what? What is pericarditis? Pericarditis in the sense, you know, this is your parietal layer of pericardium, this is your visceral layer of pericardium. In between both of them, you have got fluid called as pericardial fluid. If there is infection within this pericardial fluid and infection of these layers, you call it as pericarditis. If you are not treating it, what will happen? There is excess amount of fluid that is getting deposited within the pericardium, and that condition you call it as pericardial effusion. Pericardial effusion. And if you are not treating the pericardial effusion, the fluid becomes too much and it compresses the heart. I will explain you how it is compressing the heart, but just remember that in between two layers, here there is excess fluid, here there is excess fluid. This excess fluid, you see my thumb fingers are compressing the heart in the center, right? So that condition you call it as cardiac tamponade. Cardiac tamponade, right? Actually this condition is also seen after MI. For example, I had MI today, right? Within 48 hours I can develop, these are called post-MI complications. Within 48 hours I can have atrial fibrillation. Within 1 to let us say 2 weeks gap, within 1 to 2 weeks gap, I can have, let us say, mitral regurgitation, all these problems. Within 2 to 6 weeks, right, or 2 to 3 weeks gap, I can have cardiac tamponade. Within 4 to 6 weeks, I can have left ventricular aneurysm. So these are all post-myocardial infarction complications. Okay, so these are all the complications which will happen one after the other. So what I am trying to tell you, is that let us say this is the heart. Okay, let us say this is the heart over here. Okay, now in this heart, all of you know that we have got some structures. What is the structure? See, here we have got this layer. This is called as what? This is called as your serous pericardium. Serous pericardium mein kaun sa? This is called as your visceral layer. This is called as your visceral layer. Okay, and after that, this red color thing, this one is called as your parietal layer. Parietal layer. In between both of that, the fluid whatever you have is called as your pericardial fluid. Now right now what I am trying to explain you is that in this patient, let us say this is his aorta. This is his aorta. Okay, and this is the aorta that is coming out. Clear? And next important thing I can tell you is that here I have got superior vena cava and here I have got inferior vena cava. Okay, so this part over here is called as the superior vena cava and this part over here is called as your inferior vena cava. Okay, now listen carefully to whatever I am telling you. Now in this patient, and these are the valves. This is a tricuspid valve, okay, and on the other side bicuspid. Anyways, now in this patient right now there is excess amount of fluid in the pericardial cavity. Now when there is excess amount of fluid in the pericardial cavity, what is happening? Don't you think this excess amount of fluid will compress the heart, right? When it will compress the heart in all the four chambers, don't you think the pressure is increased? Yes or no? The pressure is increased. Now when the pressure is increased, this increased pressure from the right ventricle will enter into the right atrium. From here, what will happen when the right atrium is squeezed, when the right ventricle is squeezed? Just talk about the right side now. When both the sides are squeezed, the water or the blood, whatever is there inside, will it escape or not? Obviously it will escape out. You take a balloon, fill it with water and press the balloon. When you press the balloon, the water will try to escape out of the balloon or not? Yes. Even here also, when you are squeezing the heart, right, the blood, whatever is there, it will try to escape. So what it will do is that the blood tries to escape into the jugular vein. I mean superior vena cava, from there it will enter into the jugular vein. So what will happen? The patient will have dilation of jugular vein. So you can very clearly see that the jugular vein here is very much dilated. So what you need to understand here, patient will have increased JVP. So this is one very important point. Second important point is that normally previously this was a ventricle. This was a ventricle and previously this was a ventricular cavity. This was a ventricular cavity. Okay. Now this was a fluid that is present within the ventricle. Now because of excess amount of fluid, what has happened to the patient? What has happened to the patient? This is what has happened to the patient. You see now? You see this excess amount of fluid in the pericardial cavity, right? Because of this excess amount of fluid, what has happened? It has completely compressed the visceral pericardium. Now what has happened? Within the ventricle previously, there was sufficient amount of blood. But now the amount of blood or the space within the ventricle is reduced. So this decrease in space is called as end diastolic volume. The end diastolic volume is reduced. Now when there is less space, less blood accumulates. Less blood accumulates in the sense, less blood will go out of the heart. So when less amount of blood is pumping out of the heart, will the pressure in the artery remain same or it will fall down? Obviously it will fall down. So patient will have a second important condition that is called as hypotension. Hypotension. Okay. So third important thing is that when the heart is under full pressures, when you try to auscultate the heart, you won't listen to the heart sounds normally. So there are muffled heart sounds or mixed heart sounds, right? So three important things you can see here. What are those three important things, guys? The first one is there is a raised jugular venous pressure. The second one which you can see is what? Hypotension. Right? The second one which you can see over here is the hypotension in the patient. Hypotension in the patient. And the third important thing which you can see here is muffled heart sounds. Muffled heart sounds. Muffled heart sounds. So all these three things, if you look in a question or in any patient, right? So this condition you call it as cardiac tamponade. You call this as tamponade. So this triad whatever is there here, these three symptoms together you called as a triad. This triad whatever is there here, whenever you look at this triad in any question or in any patient, straight away your answer should be cardiac tamponade. So whenever you see this triad is also called as Beck's triad. What is this triad? This is also called as Beck's triad. Okay, so whenever you see Beck's triad in a question or in any patient, straight away your diagnosis should be cardiac tamponade. So whenever you see cardiac tamponade, now right now what should I do in this patient? Right now there are a lot of pressures that are falling on the heart. I have to reduce these pressures. I have to decompress the heart. To decompress the heart, what will I do? I will put a needle and remove that fluid out so that suddenly the heart will undergo decompression and the patient will come back to its normal state. That procedure you call it as pericardiocentesis. What is that procedure called? You call that procedure as pericardiocentesis. Now because of this pericardiocentesis, what are you doing? You are decompressing the heart. You are doing decompression of the heart. Okay, so how do you do this procedure, guys? How do you do this procedure is that this is the sternum. Lateral to the sternum, right, lateral to the sternum on the left side. Here is the place you have got your heart, right, lateral to the sternum on the left side. 5th, 6th intercostal space, you put a needle, okay, because heart is not exactly in the center, heart is towards the left side, right? So exactly lateral to the sternum on the 5th and 6th intercostal space, you put a needle between the 5th and 6th intercostal space. When you put a needle there, obviously the fluid will be drained. Okay, so decompression, how do you do? Lateral to sternum, either in the 5th intercostal space or in the 6th intercostal space, right? You put a fluid and drain the fluid. This is one method. What is the second method? What is the second method is that all of you know that this is your xiphoid process. Okay, this is the xiphoid and this is the rib. So in both of them here you have got your costo-xiphoid angle. So what you do is that from the down part you put a needle up 45 degrees like this, okay, and you drain the fluid out. So exactly if I have to show you the picture, yeah, this is a picture. You see exactly what is the angle here? This is the angle. This is the angle. What is the angle? This angle is around 45 degrees. So exactly at 45 degrees they have kept an needle into the costo-xiphoid angle. So this is called as your costo-xiphoid angle. So you put a needle into the costo-xiphoid angle at 45 degrees upward, right, and then drain the fluid. So this is another way to drain the fluid. Okay, so what are the things we just discussed here, guys? We were discussing about the sinuses of the pericardium. We mainly concentrated on two sinuses. One is called as your transverse sinus, another one is called as your oblique sinus. Okay, so here there are two sinuses here, transverse and oblique. And obviously fibrinous pericardium, parietal layer, visceral layer, these two are called as serous pericardium, you know it. So two sinuses again, transverse and oblique, right. So this is the pathway which you have to remember here. Pericarditis can lead to these conditions over here. The final condition which you need to keep in mind is cardiac tamponade. So in cardiac tamponade, three things can happen: raised JVP, hypotension and muffled heart sounds. Together you call it as a tamponade. So these are the two ways how you do a pericardiocentesis, right? So this is all you need to know regarding the sinuses. Thank you so much for watching my video. Goodbye.